Hi, welcome to Module 2. Let's work through some targeted solutions for cardiovascular disease from the Metagenics range. If you recall from Part 1, we saw how effective niacin therapy could be in managing dyslipidemia. It's also an effective adjunctive therapy for patients already on statins. This study found that in statin-treated patients with low HDL, high-dose modified release niacin compared with placebo significantly reduced carotid atherosclerosis within 12 months. So start adding niacin as part of your protocol for improving cholesterol levels and preventing cardiovascular disease in your patients. A typical dose is 1 to 3,000 milligrams per day, and titration is recommended, so start low and gradually build up the levels. For best results, incorporate this therapy into a comprehensive therapeutic lifestyle plan. Niatane supplies a high-quality source of niacin, which contributes to healthy lipid metabolism. It features a non-wax vegetable source coating for favorable dissolution and provides 500 milligrams of an extended-release delivery form of nicotinic acid, which reduces the potential for flushing. Take 1 tablet with meals once or twice daily. Lipotane is another option if you want to use niacin therapy. However, it is utilizing a different form. That's the inositol hexanicotinate. You get 500 milligrams of this combined with Google resin, which, if you recall from Part 1, also has benefits for maintaining healthy blood lipid levels. So the two components work very well in this formula, and one only need take 1 tablet 3 times daily. Another formula that has a multi-dimensional approach to help with blood lipids and heart health is Coritin. It's a combination of plant sterols, vitamin K2, and red yeast rice. If you'll recall, red yeast rice has been shown to have benefits for lipid parameters, and 1 tablet of Coritin will give you 600 milligrams of the red yeast rice. It's then combined with 400 milligrams of a variety of plant sterols, which reduce cholesterol absorption, and then 60 micrograms of vitamin K2, which is in the active forms MK4 and MK7. You need take 1 tablet twice daily with food. We saw previously how important CoQ10 is with regards to cardiovascular function, and how this important antioxidant diminishes significantly with age, as well as illness and certain medications. So many of your patients will turn to supplements to replenish their levels. However, not all CoQ10 products are absorbed effectively, and so it's important to consider some aspects. We know that CoQ10 is notoriously difficult to absorb, firstly because it's lipophilic or fat-loving, and therefore insoluble in water, meaning it's poorly absorbed and relies strongly on stomach contents to enhance absorption, so you need to eat it with fatty meals. In addition, in the manufacturing process, many commercial productions are heated up, and then in the cooling process, crystals form, and that further reduces absorption, especially of your tableted CoQ10s. For that reason, the delivery form is actually one of the most crucial aspects to consider when looking for a clinically effective form of CoQ10 to supplement with. Metagenics has a unique delivery system called Nutrigems, which is a soft chewable gel that supplies 300 milligrams of concentrated CoQ10 per serving. The Nutrigems delivery system harnesses advanced emulsification technology, thereby enhancing absorption and resulting in higher levels of effectiveness and value for your patients. The innovative chewable gel is great tasting, and therefore compliance will not be an issue. The gel tabs are also gluten and sugar-free, containing only natural flavors and colorants. As mentioned, the delivery system improves absorption, as the emulsified chewable gel converts fat-soluble nutrients into a more easily absorbed water-soluble form. This clinical study looked at how the Nutrigems delivery system was able to provide an enhanced absorption of the fat-soluble nutrients EPA and DHA. It measured a 43% higher absorption than traditional soft gels. The Nutrigems are also processed in an oxygen-free environment and individually sealed in blister packs so as to maintain freshness and stability. The blister packs can easily be dispensed to suit individual dosaging needs. We do, however, also offer soft gel options in 2 dosages. We have the CoQ10 ST 100 and 200 milligrams, which are completely soluble and crystal free. D-limonene is added as an organic solvent to emulsify and solubilize the CoQ10. The opaque, hermetically sealed soft gels increase stability as well as the addition of vitamin E, which enhances the biological function of CoQ10. These 2 formulas are the most cost-effective out of the range, considering their high potency per dose. The Nutrigem's CoQ10 comes in a box providing 30 chews of 300 milligrams each, and is ideal for patients who need a higher dosage or who don't like to swallow soft gels. The CoQ10 ST200 provides a concentrated 200 milligram dosage per soft gel and is another cost-effective option. One issue that is often brought up with regards to CoQ10 supplementation is the whole ubiquinol or ubiquinone debate. Ubiquinone and ubiquinol are redox pairs and are easily converted from one form into another in the body. So the body has an efficient mechanism in place to convert orally administered CoQ10 as needed, and no clinical studies have shown that ubiquinol is superior to ubiquinone. So this is a recap, but I feel it needs to be emphasized that the medical food Ultrameal Plus 360 is the medical food of choice for patients with cardiovascular disease. If you recall, it has been clinically trialed on patients with metabolic syndrome to manage a broad variety of associated risk factors. To summarize, in 2 separate 12-week studies, the resolution of metabolic syndrome was very similar in both of the treatment arms that were receiving the Ultrameal Plus 360, and they were significantly higher than placebo. In this article, entitled Optimal Treatments for Metabolic Syndrome, it states that using a lifestyle program, mainly the Mediterranean-style diet, that they showed a 48% reduction in metabolic syndrome over a 2-year period. We saw a 44% reduction in metabolic syndrome in just 12 weeks with the addition of Ultrameal Plus 360. When looking at total cholesterol levels, we saw more dramatic improvements in the medical food arm, and the same thing with triglycerides. We also noted a reduction in the ApoB-A1 ratio, which was more significant in the treatment arm. So overall, this comprehensive medical food with a full complement of micronutrients as well as targeted ingredients is an excellent choice. Use it to simultaneously improve a variety of risk factors as well as body composition, increase energy, and reduce cravings. As it's a medical food, it has not been associated with any serious adverse events, and all of the ingredients are GRAS, generally recognized as safe. Please have a look in your practitioner material folder for a copy of this program guide, which outlines how to get the best results with your patients. So as a recap, you have 3 options available: the Ultrameal Plus 360 available in vanilla, the Ultrameal Plus 360 in rice available in vanilla, and then for patients on blood thinning meds, the Ultrameal Plus available in chocolate, vanilla, and mocha. Now let's look at a product called vasotensin, which is utilizing peptides from the bonito fish to support healthy blood pressure. Bonito peptides have been shown to reduce the formation of angiotensin II, which is a potent vasoconstrictor, because they interact with angiotensin-converting enzyme. The product is assayed to assure product viability and the presence of specific peptides, which are known to produce an 8-fold higher activity. This formula is designed to be fast-acting and to provide a clinically effective dose in just 2 tablets twice daily. It can be used as a complement to other heart programs such as prescription drugs, medical foods, and even dietary supplements. There is no rebound or reverse effect observed in clinical trials when supplementation is discontinued. It has an excellent safety profile with no serious adverse effects associated with the peptides. What's interesting is that eating dried bonito by itself has not got any of the antihypertensive effects, because they are very specifically associated with 9 specific peptides that have the effect on blood pressure. These peptides provide safe support for anyone with pre-hypertension or stage 1 hypertension. Here you can see the new blood pressure guidelines, which outlines pre-hypertension and stage 1 and 2 hypertension. So consider vasotensin for anyone below 160 over 100. So just a diagram explaining again how the peptides work is that they interact with angiotensin converting enzymes to affect the formation of angiotensin II. They basically inhibit the enzymes to such an extent that angiotensin II production is reduced, and therefore vasoconstriction is reduced, and therefore blood pressure is improved. Human clinical trials show that blood pressure was reduced in 64% of individuals with mild hypertension and that there were no side effects. They even compare very favorably to certain ACE inhibitor drugs, but of course without the side effects. In this crossover study, you can see that for both the systolic and the diastolic blood pressure, the placebo group showed no improvements, while the treatment group receiving the bonito peptides showed a clear decrease. When the crossover occurred in week 5, you can see that the effects were switched between the two groups. Trials typically last 5 to 8 weeks, and the optimal dose was found to be 1.5 grams per day. About 2/3 of the patients responded very well to this intervention. One important thing to note is that you may need to continue for 8 weeks in order to determine any significant benefits, so don't stop too soon. So to summarize, vasotensin is easy to use at just 2 tablets per day, is very safe, and can be taken with other drugs or supplements. And here's just a case study from the Functional Medicine Research Center showing that using the formula vasotensin for 8 weeks, there was a reduction in blood pressure from 140 over 78 to 112 over 70. All right, Vessel Care is a very comprehensive formula designed to support methylation and basically helps to support healthy homocysteine metabolism. So the form of the folate in this formula is an active form known as methyl tetrahydrofolate. There's 800 micrograms per tablet. That is important because it will help to bypass anybody who has a genetic variation in their folate metabolism. It doesn't need to be converted. It's already in the active form. And it's also then combined with vitamins B6 and a methylated form of B12, as well as TMG and choline, which help to drive the methylation cycle. So we've complemented this formula then also with intrinsic factor, which supports the absorption of the B12, and we've also got zinc in here. So this is a very good formula for looking after the integrity of your vessels, because if homocysteine levels get too high, we know that it can cause direct damage to the endothelium. Cardiogenics Intensive Care provides a comprehensive formula for addressing heart muscle health. So it combines extracts of hawthorn and aruna, which are two botanicals which can help to maintain blood pressure, possibly through assisting blood vessel dilation. And then complementing these herbs is a blend of amino acids and minerals that include magnesium, potassium, and calcium that play an important role in heart muscle function and nerve conduction as well. And then, of course, taurine, selenium, and the phytonutrients I mentioned earlier also deliver powerful antioxidant protection. So you typically use 1 tablet 3 times daily of the Cardiogenics Intensive Care. Mega-10 is the more complete omega formula for heart health. It delivers a powerful combination of purified omega-7 and omega-3 fatty acids to provide targeted, enhanced support for cardiovascular health. Each soft gel provides 500 milligrams of EPA and DHA, as well as 105 milligrams of palmitoleic acid. Now, it's important to note that Mega-10 incorporates a special purified form of omega-7, the palmitoleic acid. This is important because unpurified preparations, such as those from sea buckthorn, may contain high levels of palmitic acid, which is a saturated fat, which has negative effects on many aspects of heart health. So Mega-10 is purified to remove palmitic acid. Omega-10 combines omega-7 with omega-3, and so you'll be getting 500 milligrams of high purity and potency EPA and DHA per enteric coated soft gel. Let's look a little bit closer at the science behind omega-7. In animal studies, palmitoleic acid administration suggested promising evidence to support its role in cardiovascular health and insulin function. A study from Diabetes Care in 2010 looked at high-risk patients and found a positive association between circulating palmitoleic and healthy insulin and lipid metabolism. This led to a pilot study being conducted in 2013 on 16 patients participating in a lifestyle change program, who then supplemented with purified omega-7 for 30 days, and they showed improvements in triglycerides and LDL and HDL cholesterol. A recent placebo-controlled study with 60 healthy patients demonstrated improvement in blood lipids and further confirmation of the role of omega-7s in cardiovascular health. In addition, it was also found to have a dramatic effect on high-sensitivity CRP levels with a 63% reduction in 30 days. As you probably know, the health benefits of omega-3 oils have been widely studied and range from cardiovascular support to healthy brain development and immune response. And studies have shown strong evidence that omega-3 fatty acids from fish oils can lower blood pressure as well as triglyceride levels. So omega-10 is really the perfect 10 for heart health, combining the health benefits of purified omega-7 and 3 in easy-to-swallow enteric-coated soft gels. Typically, you would take one soft gel 1 to 2 times daily with meals. And then this brings me to another medical food called Argin Core, which has been designed to nutritionally support the management of conditions associated with peripheral arterial disease, or PAD. It provides high-quality L-arginine, magnesium, folate, and beet powder to increase nitric oxide production and support circulation as well as heart muscle function. And as mentioned, it's a medical food, so all of the ingredients are GRAS, and there have been no serious adverse events reported. Typically, you take 2 scoops daily with a cup of water, and there are 28 servings per container. All right, so please have a look in your Module 5 folder for some more information on some of the formulas we've discussed in this presentation, or contact your AMIPRO rep if you have any questions. Thanks so much for listening.